All right, so today we're going to be talking about the healthcare system. And this is something that I wanted to just share some information with all of you because for those of you who will be living and working in the States, in the United States, this is very relevant and something that I wish more people were educated about. And really, it's just what to look for in terms of health insurance and how to seek care and look for the right types of providers that you might encounter if something were to happen to you and where you need to go and get care. So really, when we're talking about the healthcare system really takes a big chunk of the dollars spent by Americans every single year. And there's like a whole nother discussion about why that might be and ways that we can improve it, but that's for another day. But really, when we're looking at the numbers themselves, um, we're looking at over close to $4 trillion in spending, at least in 2019. I would imagine the numbers for 2020 hasn't come out yet, or 2021, but with the recent pandemic, I would imagine this number is going to be blown out of the water. But in 2019, pre-pandemic, the average person was spending $11,500 a year. And so if you break it down a little bit more, you can see here where you have just the different types of payers or insurance formats that pay out and reimburse this money to insurance companies or healthcare professionals. So a lot of you may be familiar with the different types of healthcare facilities. It may not. And there's a whole host of different types of healthcare facilities that people utilize. I mean, the most common ones that you hear about obviously are the hospitals. That definitely has the greatest concentration of healthcare providers in one place. Many of you may have had experience going to urgent care. So urgent care is where you're trying to receive care for something that maybe not as emergent, like going to emergency room, but you maybe have a cold or allergies, or you have the flu or flu-like symptoms and you need to get checked up so that you can get medication. Urgent care would be the appropriate place to go. You could also go if you have a fracture, like if you fell down and broke your wrist or your leg or something like that. You could go to urgent care. They usually have x-rays there where they could take images of your whatever body part that needed to be imaged and give you kind of the right guidance for that. You most likely have gone to see independent practitioners at either their clinics or medical offices, where it could just be one practitioner, one solo person, or it could be a combination of 4 or 5 different physicians or practitioners all working in the same office. And then you have a whole host of other types of facilities, and they all have their different functions, and they all work within the healthcare system and provide a specific service. But these are very much more specialized versus the hospitals is probably going to be the biggest like one-stop shop kind of place that you would be able to go to. In terms of the healthcare providers, obviously the ones that you're probably the most familiar with are the physicians. Now, physicians, if you're talking about an MD, a medical doctor, that's the type of degree that they receive and the type of training. So physicians, the MD and the osteopaths, the DO, actually carry the same medical license. They are both able to provide medical treatment. They're able to both prescribe medication, order imaging. They basically have the same rights. It's just that the difference between the two is that the physician goes to medical school, or the traditional medical school. Osteopaths also go to medical school too, but the way that they're trained is slightly different, but they all take the same board exam. They all are doctors of medicine. It's just that their bias or their slant or the way that they look at things are slightly different, but not that much so. People will say that osteopaths tend to look at things a little bit more holistically, and they actually do kind of manual techniques similar to what I do as a physical therapist, to maybe help with bones and joints and whatnot, those kind of issues. Working under physicians most of the time are going to be your nurses. So you have nurse practitioners, which are kind of one step below a physician. They're still nurses, so they don't have a MD, or they don't go to medical school. They still go to nursing school. But these nurse practitioners are able to practice a little bit more autonomously, where they don't have to get they don't have to receive orders from a physician necessarily. They can actually prescribe medication. They're still overseen by physicians at the end of the day, but they don't need to have something dictated to them for them to be able to perform a certain procedure. Obviously, you have pharmacists who give out medication. Hopefully, you're familiar with physical therapists after having spent a whole semester with me. The PTs are really, we're really experts in movement. And so we watch people move and we try and take that information and figure out, okay, what are some of the things that could be preventing someone from being able to move in an ideal way? And so that could be through looking at someone's strength, or their range of motion, or their flexibility, their coordination, their balance, and whatnot. So PT actually has a very broad scope of practice, which is why I enjoy it. Then you have the occupational therapists. So occupational therapists tend to focus a little bit more on the what we call activities of daily living. So that could be like eating or writing or dressing yourself, grooming. A lot of occupational therapists will also focus their treatment approaches on taking care of conditions relating to the upper extremities, so like the shoulders, elbows, wrists, hands. You'll see a lot of OTs specializing in that. And a lot of OTs also do work with musicians as well, not just PTs. So both PTs and OTs will, usually help musicians if they were to have a musculoskeletal or neurologic injury. Those would probably be the healthcare professionals that you would want to seek out. Speech language pathologists it's a really cool field. They take a look at a lot of different things, primarily with like swallowing. And there's a lot of SLPs that work with babies when they're learning how to feed or nurse. But speech language pathologists also look at people if they have some kind of condition where they can't enunciate quite as well. So they'll help retrain singers or retrain someone after a stroke to speak with a little bit enunciation, or help with the relearn how to swallow, for example. So there's a lot of different things that SLPs will do. And so they're all part of that rehab team. The PTs, OTs, and SLPs are all part of what's considered the allied health rehab team. And then, of course, you have acupuncturists, chiropractors, psychiatrists are actually physicians. They're MDs. They're trained in medical school with a specialization in mental health. But these practitioners, the psychiatrists, will be able to also prescribe medication to help with someone manage their mental health issues if there's like a chemical imbalance or something like that, which is different than a clinical psychologist, where they aren't able to prescribe medication, but they're able to provide other therapies, usually through talk or different activities, to help someone work through any past traumas or any issues that they're currently dealing with. Mental health therapist is kind of the same thing, but it's just a different certification. So we're going to take a look at the different types of payers next. So payers are really what we typically call or refer to as the insurance companies. These are the people who are paying the healthcare providers for their services, basically. So you have a number of different types of payers. These are probably the most common. So Medicare is the government funded type of insurance company, but usually it's only eligible to those people who are 65 years and older, or if they have a really chronic condition that would qualify them for Medicare. So examples of this would be if someone had a stroke or a spinal cord injury, they might actually qualify for Medicare earlier than 65 years of age, but that would be on a case-by-case basis. The main kinds that you'll run into probably from at this point as students all the way through until you retire would be either the PPOs, the preferred provider option, the HMOs, and then Medicaid, which would be the state funded insurance, and then out of pocket. So basically cash pay. And we're going to go through each one separately and kind of walk through what the pros and cons of each of those are. So the first one that I want to talk about is the PPO, otherwise known as the Preferred Provider Organization. And so really, this is going to give you the most amount of flexibility in terms of the types of providers that you would be able to see. So you can really go and seek a consult from any specialist without a referral from your general primary care physician. And you'll see the difference when we talk about HMOs in a second. You usually have a little bit more flexibility in choices, and you don't always have to have a primary care physician in order to go and seek other specialists. The downside of this is that obviously because you have more flexibility, these are the more expensive plans. And there could be a higher cost. So how things are structured. So in a PPO, you have a network of physicians or providers that are what's considered in network. And so what that means is that those particular providers or offices have negotiated a contract with the PPO plan, and to say that I will offer my services for a reduced rate in exchange for the PPO to send them patients within their plan. So you could go and see a provider that is in network. However, you do have the option to see someone who isn't part of the PPO plan. However, the cost to you as the patient or the consumer would be a little bit higher. And all of that depends on the type of plan that you have. So the differences between the in-network and out-of-network, like I said, is highly dependent on the type of plan that you have. And I'll give you an example, and so you can kind of see what the differences are with that. But the true benefit of having a PPO type of plan would be the flexibility in being able to see practitioners who you want to see, versus being dictated by the HMOs. So the HMOs stands for Health Maintenance Organization. These are also from a lot of the insurance companies will offer these types of plans as well. Kaiser Permanente is probably the biggest HMO plan. They're HMO exclusive, so they only offer HMO plans because everything is done in-house, even their hospitals are. So HMO plans are a little bit more restrictive, and but the pro part of it, depending on how you look at it, is that it's a slightly cheaper plan. So in these kind of plans, you actually have to have a primary care physician, and that primary care physician is kind of like the gatekeeper. That if you needed to go see a specialist, let's say that you, I'm going to keep on using this example, you fell and broke your arm, or you fell and hurt your rotator cuff, and you needed to go see an orthopedic surgeon to get some advice as to what the next steps are, you would have to go through your primary care physician first, who would then refer you to an orthopedic specialist within the HMO network. And then you would be able to go and see that specialist. Versus in the PPO, you fall and break your arm or you injure your rotator cuff, you could just call up orthopedic surgeon and be like, when can I schedule an appointment to see Dr. So-and-so? But like I said, it is a cheaper plan, but the downside is that it could really increase your waiting time between the time that you see your doctor to someone who you would see as a specialist. You're very limited in seeing, like, you're really not able to choose for the most part who you see in terms of specialists. You would be able to choose your primary care physician as long as they are within the network of your particular HMO plan. And then there are much tighter restrictions and limitations in the benefits that you would receive within the plan. So that would be the kind of downside of that. A lot of people will choose to have HMO plans if they're generally healthy. They don't really use their health insurances that often, but it's there if you need it. PPOs, because they're more expensive, they have more flexibility. People either like to have that option as an option, or they use their insurances much more. A lot of what you see now with the Affordable Care Act that went into effect a few years ago, otherwise known as Obamacare, a lot of the plans that are that fall under Obamacare, because there's a lot of different types of plans that the Affordable Care Plan offers. A lot of them are HMOs, so it's like the bare minimum type of health insurance plan. Medicaid, so this is for people who fall below a certain income bracket. And so this is a state-funded, somewhat government-funded, but mostly state-funded health insurance plan. And so you're really going to, it's only going to be like dependent on state to state what those requirements are, what the income cap is going to be. Children who have underlying conditions either at birth or after, they could also qualify for Medicaid. In the state of California, it's called Medi-Cal, so Medi and then Cal for California. And then it's also available to patients for those patients who have long-term disabilities, similar to Medicare. But Medicare is the US government-funded health insurance plan. In order to qualify for Medicaid, you actually have to be a US citizen and be a resident of the state that you're applying for. And then it's even more limited than the HMO. You actually, similar to HMO, you have to have a primary care physician. But the types of practitioners that accept Medicaid as an insurance payer are even less than what you would find in an HMO. And then oftentimes you would have to wait to get authorized to receive any kind of treatment or imaging, or and so that could delay your care slightly just because of the process that it takes for them to go through to approve it or not. Last but not least, and probably the most flexible of them all, is to pay out of pocket. So this would just be like you open up your checkbook or you open up your wallet, you hand someone their fee for their service, and then you're done. Basically, almost any healthcare provider will accept out-of-pocket payment. So, obviously they still have to function within their legal limits. They can't just go carte blanche and do whatever they want, but you really have an endless amount of possibilities. If you want to go see 5 specialists, there's no insurance company that is like, why are you doing that? You can't do that. We're not going to pay for it. So you could also receive treatment that may not be covered by insurance. So a lot of insurances, more these days, but a lot of insurances don't cover, stem cells injections or what's called PRP, otherwise known as platelet-rich protein injections, to help with inflammation and whatnot. So people would pay out of pocket, pay these physicians or medical labs out of pocket to receive these treatments, instead of waiting for their insurance to go through that process and then at the end of the day getting denied. The con is that the insurance won't pay for these things, so you're not going to get that money back even if you paid that out. Okay, so that was a brief rundown of the different types of payers, so the different kinds of insurance that you might run across, and hopefully you have a better understanding of like why one type of insurance might be better than the other. But within that umbrella, let's say that you want to purchase insurance from Anthem Blue Cross. Within Anthem Blue Cross in itself, they could have like 20 or 30 different plans. And so being able to go through and understand what each plan offers and like what it would mean to you if you were to use all of your benefits in the year. So understanding that is really what is the most important portion, other than understanding the structure of the plan and what that would be able to provide you. So these few terms here are really the main ones that you really need to know and be mindful of. So in network, I explained this a little earlier before, but in network is that where a provider is contracted with a specific health insurance plan, and in exchange for that, the provider provides a lower rate for their services. So you don't pay quite as much because that provider might be receiving 200 patients from Blue Cross Blue Shield a year. So it's kind of like a bulk discount, if you will. Out of network is basically any practitioner who doesn't contract with the plan. And so what they charge out of network is what you would pay or what would go towards your insurance benefits. So the first main term that I want you to think about, and we'll go through an example of this in a little bit, but the first one that you should be paying attention to is the deductible. So the deductible is really the amount of money that you would have to pay out of pocket first before your insurance even kicks in. Some plans have low deductibles. It could be as low as zero or as high, I've seen as high as like $3,000. And the difference with that is how expensive the actual plan that you purchase is. So those plans that have a $0 deductible is really great because your insurance kicks in right away. However, those plans are much more expensive versus you having to fork over up to $3,000 first before you can even use your insurance. Those plans are going to be a little bit cheaper because it's less liability for the insurance company to have to pay out before they start paying the practitioners. The second term I really want you to be aware of is your out-of-pocket limit. So this is different than the deductible. So the deductible is the amount of money that you would pay before your insurance kicks in. Your out-of-pocket limit is the total amount of money that you would pay in a calendar year. So usually with health insurance, it runs from January to the end of December, and it starts over in January again. So the out-of-pocket limit is really how much money would you, in the worst case scenario, need to pay out of your own money in a year. The copay is something that again is negotiated with the plan, but it's just a small amount of money. Usually it's usually less than $100. A copay is something that you would pay either the pharmacy or the office that you're going to see the doctor at for each visit that you have. So it's a portion of the total cost of the visit, but it's a set rate. So if your plan said that you have a $25 copay for every office visit, no matter what office that you go into, you would pay $25. It doesn't vary from office to office. Some plans will have copays as low as 0, where they don't have any copay. And some plans will have something where as high as I've seen like $75. So again, the amount of copay also depends on how expensive or how much you're already paying for your insurance plan. And the last thing we'll talk about is called coinsurance. So this usually is relevant once you have met your deductible. So you've already paid out your deductible through different practitioners, and now your insurance has kicked in. So sometimes in a plan, they will say, okay, we will cover 80% of the cost of the visit, and your coinsurance, or what you have to pay, even though you've met your deductible, will be the other remaining 20%. Now, that 20% coinsurance will add into the out-of-pocket limit. So let's just say you see your out-of-pocket limit is $100, and every office visit is $100, and you pay $20 as your coinsurance. So you could do 5 office visits to reach your out-of-pocket limit through the payment of your coinsurance. Hopefully that makes sense, but we'll go through an example so you can hopefully apply this a little bit better. Okay, so this is what I pulled from your health insurance as a student at Colburn. This is what your student health insurance will cover. And I've posted a copy of this on Canvas, so you can access the whole document and take a look. And they actually did a fairly good job of providing other examples as well if you wanted to read through that. But this is a general breakdown of your health insurance. So if you look in the upper right corner, you have your plan type. So your student health insurance is a PPO. So again, this offers you the greatest amount of flexibility in terms of the types of providers that you can see. You don't have to have a primary care physician first in order to go and see a specialist. Now, your deductible, so there's two different deductibles for different scenarios. So those practitioners who are in network, so the preferred providers is another fancy name for your in-network providers. And so in a calendar year, you will you will pay $250 in order to meet your deductible for your insurance plan to activate or to kick in. If you go see someone who is out of network, that deductible will be $600. Now, let's say that you go see different practitioners and one of them is in network and one of them is out of network. They don't add together. So the out of network practitioner you would still have to pay that $600. And then the in-network person, you would have to pay the $250. So the overall deductible, depending on if you use in-network providers or out-of-network providers, could either be $250 if you're in-network, or if you see a combination of the two, both in and out of network, it could be up to $850. So next, you have the out-of-pocket expenses. So again, remember, this is the total amount of money that you would potentially spend. And once you pass that number, you wouldn't have to pay anything else. The insurance will cover everything else 100%. So what that looks like is, so for those providers who are in network, for one person, for you yourself, you would have to pay at most $6,850 in a calendar year for in-network providers. This family thing here is if you have other dependents, if you have a child or you have a spouse who is also under your insurance plan, this would be the total amount for all the people involved who are under your plan. But most of you, I think it's just you who has access to the plan, so it would be $6,850. For those of you who choose to go and seek out-of-network providers, the out-of-pocket limits would be $15,000. So you would potentially pay up to $15,000 before you no longer have to pay anything else. So again, these are just things that you need to be aware of and mindful of as you're looking for the different plans that you have. Some of you may not have this plan. Some of you may still be on your parents' insurance plan, and that could look very different. It could be better or worse, and it really depends on the type of plan that you're currently on. But this is the Colburn, this is the one that Colburn provides for the students. So just, I think most of you would have something like this. But again, this is just another way of being able to look and see what your benefits are. All right. So further breakdown. So we look and see what your copays and coinsurances are. Okay, so if you were to go see your primary care physician, every time you go and see them, it would be a $25 copay, no matter whether or not you've met your deductible or not. If you go and see a specialist, so if you went and saw like an orthopedic surgeon, for example, or ear, nose, and throat doctor, it would still be $25 copay, regardless whether or not you've met your deductible. And this is the in-network provider. Now, if you go out of network, then you would have to be responsible for 40% of the total cost of that visit. And that could range depending on what the doctor or the specialist does with you in that particular visit. So there's not like a set amount, but it would be 40% that you would be paying the practitioner regardless of if you met the deductible or not. If you need medication, if you need to go to a pharmacy, most pharmacies are going to be in network, so you don't really have to worry about the out of network part of it, of things, really, unless you have like a really specific medication that you need access to. But these are going to be kind of like your different levels of drugs. So the tiers could be like more like tier 1 would be like your generic medication. It's not the name brand ones. So the different copays would vary depending on which tier that medication that you are prescribed would fall under. And they would be able to tell you that. Okay, so this is like a very general thing, but these are really the main things that you would want to be mindful of and look at. So we're going to go through a really, really brief scenario. So if you were to go see a physician in network, so this is someone who's negotiated a contract with the insurance, so it would be cheaper to you regardless if you have a PPO or a HMO. So let's just say that you go and see this doctor and their visit is $300 for the visit. And then you get sick, and so they need to run some blood work. So that would be another $300. And then they prescribe you medication based on what they found in the blood work. So that would be $150. And these are just kind of like the pure prices. This is before insurance has done anything. And then you go, so you finish your medication, you leave, and then you come back for another checkup. So it's another $300. And then so your total expense before insurance has done anything is $1,050. Okay, but that doesn't mean that you have to pay that up front. This is just kind of what it would look like potentially. So then we take the $1,050 and then we look at the deductible, right? So, or your benefits, your overall benefits. So your deductible if we're going off of Colburn's student health insurance, is $250. So you've met that. So you would have to pay that $250 on top of the copay. So looking at the rest of your benefits, we know that there's a 20% coinsurance. So 20% of that blood work would be $60 here. And then you get medication and you get the generic, very common medication. So that would be $25. And then the second visit you go back to, because you've already met your deductible, you don't have to pay that $300 except for the next $25 copay. So in total, so instead of having to pay $1,000 plus, instead you would only have to pay $385 for an in-network 2-visit cycle with your doctor if you get sick, for example, and you really needed to go and get care. So that's just one example. On the form or on that PDF that I put on Canvas, it has a few other examples as well. So you can take a look at that, or if you have any questions, just feel free to ask me. I'm happy to walk you through that, more examples as well. Last thing I wanted to mention is those of you who will have like employment or be employed by someone who offers benefits. This would usually be those of you who like have full-time jobs, regardless of what that is, whether it's working for orchestra or whatnot. There are 2 different kinds of savings accounts that you can have that would help offset some of the health cost to you. So there's the flexible spending account, the FSA, and a health savings account. So really, there's some key differences between the 2. The main one, so the FSA is also known as the cafeteria plan. I don't really know why it's called the cafeteria plan, but it is. But anyway, so the main difference between the FSA and the HSA is that the FSA, you contribute a certain amount of money every year. Let's say that you want to set aside $1,000 for healthcare expenses every year, just kind of like a rainy day fund. However, the caveat with the FSA is that you can contribute $1,000. However, if you don't use that $1,000 in the year, you lose it. It's like use it or lose it. You don't get to carry that over into the next year. It doesn't accumulate. So you really, if you're going to have an FSA, you really have to strategize and think about how much money you would really want to set aside realistically, so you don't overshoot and lose out on some money that you had already contributed. You can use the FSA on a number of different things. If those of you who have eyeglasses, you can use that to contribute towards that. I've seen FSA accounts contribute towards getting massages or acupuncture treatments just for prevention. So there's a lot of flexibility in terms of what you can spend the FSA money on. It does have to be health related. Some FSAs will also reimburse gym memberships as well. So again, you have to understand what limitations or what parameters that particular FSA will allow for, so that you can kind of set aside that money. So it's kind of, you don't accidentally spend money that you had already set aside for something else that you might need. But like I said, both of these things are kind of like your rainy day fund. Like obviously you hope to never have to be sick enough to use these funds, but they're there if you want them to. The HSA usually is offered if you have health insurance plans with high deductibles, remember? So the deductible is the amount of money that you would need to spend before your insurance benefits really kick in. Both you can have your employer contribute to these funds, but most of the time it's you who's putting in money. Your employer might match some of the amount up to a certain percentage of what you put in. But the difference with the HSA is that your balance will roll over every year. It's like a savings account, but really the savings account is for only things that you can use that are healthcare related. And the nice thing with the HSA is that you can keep your money if you switch employers. So if you change jobs, you don't lose all of the money that you had saved up over time, that you can actually take it with you and move it to your next job. So those are really just a few of the things that I wanted to touch on in terms of the healthcare system. I mean, obviously the healthcare system is highly complex and changes on a regular basis all the time. But what I really hope that you take away from not only this lecture, but kind of the course of the semester is really trying to educate yourself about all these little things, these different components. Learn how to take care of yourself as well, and make sure that you advocate for yourself too. So if you don't feel that you're getting the right kind of care from your practitioner, talk to them about it. Or if you really don't feel comfortable talking to them about it, look for some practitioner, or look for a healthcare provider who you feel comfortable with discussing really personal things with. And I know I spent a lot of time talking about the insurances and whatnot, but you really should not hold back treatment based on cost alone. There are many ways that you can work through, trying to pay off some of the stuff. And obviously it's not ideal, but you really shouldn't hold off on receiving care if you really need it, because oftentimes what happens is if you delay care, it actually makes problems worse and more expensive potentially. So, really use your best judgment. You all know your body's the best. So really, the more knowledge that you know, the more information that you know, the better choices that you can make for yourself so that you can, make the right decisions. But so that's just a brief summary of the healthcare system. I know there's a lot more, but I think those are probably the most important things that you would need to know, kind of going out into the real world. So hopefully that's helpful. And I hope that you have learned something from this particular lecture, but then also from the remainder of the semester. So it's been really, really fun sharing my knowledge and information with all of you, and hopefully you learned something as well. All right, have a great holiday and break, and hopefully I'll see you around campus.